Here's exactly how to get HRT, step by step, including what to look for, what to avoid, and what the process should actually look like when it's done right. Because too many women spend months bouncing between providers who either don't prescribe hormones or prescribe the bare minimum. And there's one red flag that tells you immediately whether your provider actually knows what they're doing on this. I'll get back to that in a second. Before you sign up with any provider, online or in person, make sure they check these 4 boxes. Number 1, they prescribe all 3 hormones when indicated: estrogen, progesterone, and testosterone. This is the red flag I mentioned. If a provider doesn't offer testosterone for women, in my view, they may be giving you incomplete treatment. That alone tells you they may not be up to date on the science, or they're not willing to deal with the regulatory complexity. 2, they customize your doses. Not the same prescription regardless of your symptoms. Your hormones are yours. The doses should be built around what you are experiencing. 3, they monitor you. Your provider should be tracking your symptoms and adjusting your treatment dose until you're dialed in. Here's your prescription, see you next year, is not monitoring. Number 4, they listen. If your provider dismisses a symptom, rushes through your visit, or says your labs look fine when you feel terrible, that's not the right provider. If your current doctor checks all 4, stay with them. Good HRT care exists, and I'm not trying to replace a good provider. But if you're getting 2 hormones when you should have 3, a generic dose of any of them, and a 10-minute appointment twice a year, you deserve better than that. Here's the step-by-step of what HRT actually looks like when it's done properly. Step 1, evaluation. A real provider specialized in this treatment talks to you. They ask you about your symptoms, your history, your goals, not a chatbot, not a questionnaire that auto-generates a prescription. This is where you find out whether this provider is treating you as a person or processing you as a number. Step 2, custom plan. Based on that conversation, your provider builds your treatment. Perimenopause usually starts with progesterone and testosterone. Full menopause is often treated with all 3, doses that are specific to you. Step 3, the treatment shifts. Hormones show up at your door. For most women, that's a topical cream with a 1-click dispenser and a progesterone capsule. No pharmacy lines, no insurance fight. And step 4 is optimization. This is the part most clinics skip. 12 weeks of bi-weekly check-ins with Fountain. Your provider reads your symptom reports, adjusts each hormone medication up or down. By week 12, you're dialed in, the right dose of each hormone calibrated to how your body responds. One thing most women don't know: for most women starting HRT, we diagnose and adjust based on your symptoms rather than relying on a single blood draw. Unlike testosterone therapy for men, your provider doesn't need to chase a number on a lab panel. Your provider diagnoses and adjusts based on your symptoms, how you feel, which is actually more accurate because women's hormones fluctuate too wildly, especially during perimenopause, for a single blood draw to mean much. And the symptoms are really the key. Getting HRT should not be this hard. But now you know exactly what to look for and exactly what to expect. At Fountain, it starts at $35, full evaluation, video call with a real provider, custom plan, including all 3 hormones when appropriate, 12-week optimization period, and treatment shipped right to your door. If you don't qualify, the $35 is refunded. Links in the description.